While significant inroads are being made in the fight against HIV and AIDS in the Bahamas, the Ministry of Health revealing today that the country is seeing promising results and nearing the end of a long fight. Our Tyler Simonet has the latest statistics in our top story tonight.
HIV and AIDS are infections that have been plaguing the world, including the Bahamas, for a number of years, with its peak starting in the 1990s, taking millions of lives in its wake as the world desperately sought a treatment or a cure. Nearly 30 years later, good news coming out of the healthcare front, as Minister of Health and Wellness Dr. Michael Darville reports that 95% of people living with HIV in the Bahamas now know their status, and the end of the epidemic is in sight. The Bahamian government has the goal to end the AIDS epidemic by the year 2030, with goals before then already on the fast track to being met.
Interim targets for the year 2025 includes identifying 95% of people living with HIV, placing 95% of positively identified individuals on antiviral therapy, ensuring that 95% of those on therapy achieve undetectable viral loads indicative of treatment success. I am happy to report that the Bahamas has showed steady progress towards reaching these new goals as we move to reduce the level of AIDS and HIV in the country.
At the end of 2021, 4,327 people were living with AIDS in the Bahamas, with over 3,000 people on medication for the disease. When it comes to children in the Bahamas who are HIV positive, Dr. Forbes indicates that less than 200 children in the country are afflicted with the disease. As of 2021, the rate of mother-to-child transmission has been nearing 0% for the past few years.
Over the years, from the year 2003, we have had a robust program whereby pregnant women who have HIV are put on medications. And if they're on medications early, and if we can get them to that undetectable viral load, they're very unlikely to have a baby that's born HIV positive. And we also have mechanisms whereby if they don't reach that target, they can have a cesarean section. And so overall, in the last 10 or more years, the rate of mother-to-child transmission has been very low.
Now, with health officials working diligently to ensure that their 2030 goal is met, Dr. Nikia Forbes reveals that they do have an issue with persons hoarding HIV medication, and she's calling for a unified system to ensure that health officials are able to order the correct amount of medication for those infected within the country.
If someone is coming in who's living with HIV and they're using multiple names, for example, they're using 3 different names and then going to 3 different treatment sites and collecting 3 times the amount of medication, there can be hoarding in that way. And that is something that we have noticed as we try to have more accurate information and have confidential ways of ensuring that we have one patient profile, like using unique identifier numbers and other information. That is something that we have found. And there also can be, well, some of our providers collect medications and give it on behalf of the patient. And so there is the potential, for example, if a patient doesn't pick up medicines, there could be medicines sitting in the offices.
Dr. Forbes stresses how important it is for the health sector to also address the stigma associated with the disease, but says they have come quite a long way. Tyler Simonet, Eyewitness News.